my pleasure to introduce our next speaker, Pat Martens. Pat Martens is a professor in the Faculty of Medicine's Department of Community Health Sciences at the University of Manitoba and the director of the Manitoba Centre for Health Policy, which, as you all know, is an internationally acclaimed university-based research center. Dr. Martens has had all sorts of research career awards, including a CIHR New Investigator, and right now holds a CIHR Public Health Agency of Canada Applied Public Health Chair. Also, interestingly, she was named the 2010 YMYWCA Women of Distinction for Health and Wellness Award, I guess, and has published well over 100 articles, books, and abstracts. Dr. Martens also directs the Need to Know team, a collaborative research group of university academics working with planners from Manitoba's 11 health regional authorities and the Manitoba Department of Health. And this team, the impact of their research was recognized in 2005 with the CIHR's National KT Award. So thank you, Dr. Martens, and welcome.
Thanks for that kind introduction. Of course, you'll notice the title. After all, it is an anniversary, right? And so if you notice my attire, very fancy. This is not usually the way I go to work, trust me. But hey, it's a celebration. And if there's feedback, you might have to turn off this mic here. So I've got a lapel mic on. So one of the themes that I'm going to talk about in the next half hour is the little black dress. So I'm going to keep you in the mystery and suspense to see what I mean by the little black dress. But as you know, well, I love the analogy. David called us cousins. You know, the tale of two centers. The Manitoba Centre for Health Policy and ICES is what we're going to be talking about. I sat there wondering, are we kissing cousins or just cousins? But yeah, that all goes along with this little black dress. But for those of you who are unfamiliar with the center, it's basically very similar to ICES, except that we have the quote-unquote privilege to be in the Byzantine Empire of the university rather than a distinct unit outside the university. But we've been around since 1990, and we celebrated our 20th 2 years ago. Thank you, David, for coming to our 20th. And it's about 70 people hired at the center between full-time and part-time people, and over 100 adjunct scientists. But about half or a little less of our funding comes from government and the rest from CIHR grants. And if I show you the mission, it's going to sound awfully familiar. I guess there was a lot of wheels turning in the 1990s because they were sounding very similar to each other. But the Manitoba Centre for Health Policy focuses on research on health services, population and public health, and the social determinants of health. Sounding familiar? So that's one of what we call our pillars. And then the second pillar, beyond research, is the repository itself, which is the population data. And the third pillar that we have is knowledge translation, making sure that that research is applied into evidence-informed policy, practice, and decision-making. And if you look at your ICES goals, wow, this is very similar. Conduct research that contributes to the effectiveness, quality, equity, and efficiency of the healthcare and health services in Ontario. You do population health services research, you have informed decision-making, and one of your focuses is clinical epidemiology. And ICES has lots of data holdings. I went to the website. This is just one of the many pull-out menus that you can get, just like at the center, where if you go to our site, you can pull up the whole list of databases. There's over 100 different files and well, at last count, 63 different databases as of last fiscal year, but we've already brought in about 5 or 6 more beyond that, and you'll see that later. An escalation, especially in the social services data, since about 2001. Now, here's the LBD. What's an LBD? Little black dress. Yeah, so here's our linkable repository. We just last week signed the agreement to bring in the justice data. We've been using education and family services data for a whole long time, and so this is just a smattering of the different kind of data that cross over the health services and the social determinants and social services data. So why do I call your repository of data and our repository of data, a little black dress? Well, you've got to go back in history a little. Did you know that Coco Chanel in the 1920s invented the term the LBD? It's intended to be long-lasting, versatile, affordable, accessible to the widest market possible, and in a neutral color. Boy, that sounds like our data, wouldn't you say? Absolutely. And it's meant to be a staple of the wardrobe for a number of years. 20 years back, hundreds of years into the future, who knows? The style of the little black dress ideally should be as simple as possible. We've got good, simple data that can answer very complex questions. So do you agree with me? Is it an LBD, your repository? Yeah, I'd say so too. You know, there's lots of LBD icons of fashion in the world today, all the way from, you know, Ginger Rogers, all the way to, of course, Kate Middleton, all in their LBDs. And so, you know, here's our LBD kind of icons at the center. You know, I was thinking as I was looking at all of your CEOs that we've basically only had 2 directors since the start. So you're triple ahead of us. Nora Liu and Les co-directed, along with some co-directing from Charlene Black, the only person here who's actually wearing an LBD. And of course, Evelyn, although Evelyn Shapiro was not a director, she was definitely directing behind the scenes in a number of ways, if you know Evelyn. So I've been the director since 2004, and at our anniversary 2 years ago, we actually published a healthcare policy supplement that goes into both the political and the research history behind how the center was developed. So it might be an interesting read for some of you. Fraser Mustard was instrumental way back there. All sorts of interesting people in the history. And we actually hired a qualitative research scientist to do this history. So there's a much more complex one on our website, but there's a smaller article in this. Okay, so here's the icons of ISIS. Unfortunately, nobody is wearing an LBD, so I'm going to just change that there. I was almost tempted to put David Hare, but I didn't think that he'd appreciate that. So, yeah, thank you, Jan, for your LBD. Now, of course, a little black dress isn't terribly interesting as just a little black dress. You've got to accessorize a little black dress. For example, the beautiful handbag. Right? Every LBD needs a little black handbag or a little colorful handbag to add a little interest. And this is kind of like our safe environments at the center and at ISIS. We keep the information safe in our data laboratories. And then, of course, the jewelry. Every LBD needs some classy jewelry to go along with it. And what is this? Well, it's taking this data and making it a bit flashy. Because you know, I always get a charge out of people who at first use administrative data. It ain't anything like a survey, is it? It doesn't have nice little questions with nice little answers. It's really messy kind of data. And so you have to jewel it up by using it in creative ways to produce really neat research, just like we heard this morning. And then, of course, the belt. You know, you need to tie all this together in some clever way. And we've put an awful lot of emphasis since 1994 through Les Roos's vision to create a concept dictionary and a glossary that's available worldwide. So if you want to figure out something like diabetes or continuity of care, all the definitions are up on our website so that people can do comparable work or even perfect our work even a little better so that they can add to the concept dictionary and glossary. We're thinking that we need to have ways to almost make it a wiki thing so that concept dictionaries and glossaries from all over the world, from centers like ours, could collaborate together in much more creative ways. And then, of course, sometimes you use a bit of a shawl, and sometimes it even gets more serious with scarves. Now, as we all know, and I'll take this scarf off in a minute so it won't interfere, we've got to treat our data well. We have to. We've heard one province's woes in the news just in the last month or two. We know how important it is to have a climate of data privacy, confidentiality, what is considered a data breach, and how to avoid it. And so, just like you, in Manitoba, we work extensively with our ombudsman, as well as with all sorts of ways to protect the data, to make sure that we're respectful. We go through ethics, we go through a Health Information Privacy Committee vetting. Very important. And of course, nice shoes. These aren't the classiest shoes, but you know, they're relatively nice shoes. Nice heels here. Yesterday, I was with my granddaughter. Yes, I only have one too, and she decided that she was going to play superpower in Rona. So she was whipping down the aisle, and I was running after her. She said, "Grandma, you don't do it right. You have to say, not superpower, you have to say superpower." So here I was in Rona, running down, playing superpower, and tripped. So these shoes are a little uncomfortable today, but hey, no LBD is without classy shoes. And what are classy shoes in our LBDs? It's the KT. It's making sure that our research walks and talks. You guys do a fabulous job of that in the national media. Well done. We also have to do it at the policy making and the clinician realm. Well done. We all need to work on creative ways to make that happen. Pam Slaughter, where are you? There you are, Pam. One of the very first attempts at a privacy document that documented every single province's approach to administrative data was headed up by ISIS and the center working together. Pam was a lead person from ISIS and Paulette Collins from the center, and of course other people were involved that you might recognize the names of, like Andreas and myself and Nora Liu, etc. So it is important to try to get things right all across Canada and to share the wealth of our knowledge, because after all, you guys and us have had a lot of experience. So with a lot of experience in a little black dress, you got to share your mentorship, right? You make sure that you let people know what you're doing. This is the building that we're in. It's right now a little bit under construction. You can see a big crane there, and I'll show you what the construction was. But this is the Faculty of Medicine in downtown Winnipeg, and we're on the 4th floor of the Brody Center. You know, it's really interesting because you see this beautiful atrium. It has live trees growing in it in the winter. It's absolutely spectacular. But the windows were leaking a little bit. So the other day, they started a construction site where they had to build up all this scaffolding in order to do little repairs on top. So, you know, I always look for analogies when I'm walking through buildings or going on airplanes so that I can use it in speeches. And I thought, wow, this is the perfect analogy. For ISIS and the center, we have put a lot of work in that scaffolding that isn't really visible to the outside world in order for research scientists to be able to do a little bit of work up here. But without the scaffolding, you could not do the work at the very highest level. And that scaffolding is making sure the data are there, making sure that the data are managed, making sure that the data are correct. You know, I kind of got a real chuckle because I had already taken these pictures, and then I walked out the front door, and here was the truck on which all the scaffolding was, and they were bringing it in, and I went into hysterical laughter because it says, "For a fast erection, high rise." Woohoo! Okay. So I thought, fast is all relative. It took them about 4 weeks to do that scaffold. And I thought sometimes scientists get frustrated with us that it takes a while to get the access to the data. Think of the scaffolding. It takes a lot of work to be able to finally do those analyses that get you the publication. So, how do we take the repository to new places? Well, at the center, we have a direct connect with government. They give us a little less than half of our funding and have since 1990-91. And so at the government level, we have 5 projects a year that I decide with the deputy minister and the minister on which are the priorities to do. And these reports are big. They usually take 2.5 years to complete unless they're a rapid turnaround deliverable. But we also have one of those 5 that is with the Healthy Child Committee of Cabinet, which is a unique thing in Manitoba, where all of the ministers and deputy ministers of, help me Marnie, is it 7 or 9? 10. Of 10, thank you, of 10 different ministries like justice and healthy living and health and education and family services, all these things that intersect into child health, they meet on a regular basis. And so they also choose one of the deliverables from that perspective of more the social determinants of health. But, you know, I love that Government Connect. I think it was Andreas or somebody who said, you know, sometimes people thought, whoa, this relationship isn't really academic. You know, that really bugs me because more and more we're realizing that is academia. That is part of the job of academia, is not only publishing in great peer-reviewed journals, but it is making sure that our research connects, gets into action, and really does improve the health and well-being of our populations, whether they be Ontario, Manitoba, or extended nationally and internationally. So it's a real privilege for us when we finish a deliverable that we go brief the deputy, the Minister of Health, the cabinet of this Healthy Child Committee, all the assistant deputy ministers, anybody else that we think is going to be affected by these data, like other government agencies or clinicians, etc. It's a real privilege for a scientist to be able to sit down with the Minister of Health and in 10 or 15 minutes say, these are the key points you ought to know when that report comes out next week or 3 weeks from now. Of course, we all do public arena research and the typical research forum research. And then in Manitoba, just like you mentioned today, we have a connect with our regional health authorities. We have had since 1994 annual workshop days, not just generally for scientists, but more geared towards the regional health authority people or the Manitoba Health people, or specifically the Winnipeg Regional Health Authority, which is quite different than those outside of Winnipeg. And for the very first time, next month, we're going to do one with just family services and education, those ministries, so that we can really, really help them to understand the data too. And those have been a fabulous experience of getting the knowledge understood, used, and appreciated. Because I can tell you, when you go to renew a contract, like your directors have had to do, CEOs have had to do, and I have to do, you have got to make sure that it's not only interesting to the research community, but it is interesting and supported by those people who have to make the decisions in Manitoba at the government level and at the regional level. And therefore, we produce something that is more integrated knowledge translation at the beginning instead of the end, which we call the Need to Know team. So here's a picture of our annual workshop day. Our rural and northern regional health authority days usually attract between 150 and 200 people, and pretty well every regional health authority brings most of their boards with them. And you know, I live in rural Manitoba. I actually own farmland, and I know how to drive a tractor and a cultivator and a sugar beet harvester. How many of you can say that you know how to drive a big farm tractor? Yes, good for you. I bet you're great rural epidemiologists because of that. And you know, the board of directors are often the bank managers, the hog farmers, they can come from a variety of different areas, and yet they are charged in Manitoba with making these decisions along with the CEO. So they are part of our annual days, and they have become so adept at so many years about looking at our data that they are fabulous at it. And we have these roundtable discussions after we highlight a report that is led by people from the RHA, the Need to Know team members, and scientists from the center. And we can look at data and we keep saying, find the stories in the data. These are often observational data, but you know the context, you know the stories, and what grabs you so that you can take it home and actually find out more about this, look into it, or have a plan which you need in order to understand and take action on this data. And then the Need to Know team. That started in 2001 through a lovely grant from CIHR called the Community Alliances for Health Research. And so we decided, much to our chagrin, that no matter how great our reports looked to research scientists, when we took them back to those round tables, the regions would go, like that's a really stupid indicator. Or, you really got that wrong. Didn't you know that our region doesn't include this? And so it was kind of embarrassing. So we thought, why are we doing this at the end and telling them to open up their mouths and we just shove in this good stuff because we know it's good for them? No, that's kind of a stupid way to do research. Why don't we integrate them at the beginning? And so we asked each of the CEOs of each of our regional health authorities to choose 2 top-level planners. And I didn't describe to them what type of people they would be. And so as a result, they're eclectic. In one region, it's the medical officer of health and the quality care person. And in another region, it's the VP of planning, and on and on and on. So it's a really neat bunch. We get together 3 times a year for 2 days at a time in order to create new knowledge of relevance to Manitoba regions, to capacity build amongst us, the regions, and Manitoba Health, and to make sure that our research gets into action or gets disseminated. It is highlighted in one of the Knowledge to Action publications of CIHR if you want to look further into that. So now let's mix up for different venues the research. I just picked up a magazine 2 weeks ago. I could not believe it. I thought, whoa, she stole my shtick here, you know. But then I started to think about what this says. I helped turn data into little black dresses. Now this is kind of cool. She's a CMA and she's in the design industry. So you take this repository, which is an LBD, you use the data in creative ways, and she actually produces real black dresses. That's kind of cool. That's kind of like us producing real research that's in the real realm. You know, sometimes observational data are really slammed. This was during the Olympic Games, the Olympic gold medal hockey game. I'm sure all of you remember exactly where you were. And the green line is Edmonton water consumption the day before. That's your, comparison group, like any good quasi-experimental design. And then this was the water consumption, end of the first period, end of the second period, end of the third period. Canada wins. This is the water consumption. Everybody quickly runs to the bathroom if they possibly can make it. Medal ceremony, all of Edmonton goes to the washroom. I think that we slam observational data too much. And IHSPR and IPPH have done a lot of thinking about this in the last few years, and I've been to a lot of different workshops. Time trend analysis with a good comparison group is really great data. And with the statistical know-how in this room and at the center and various places around the world, we can do amazing things that is coming closer and closer to approximating as good as it gets, almost RCT data. So, of course, I've been using this slide for a while. Wouldn't you know, Donald Rettelmeier, he actually did an observational study during the Olympic gold medal television broadcast. Did you know this? Really cool. And so he found that, people didn't go to the ER, right? The ER during the hockey game, there was his control group, I think, different day, and there was the broadcast group. So it had huge effect, especially, Dawn, where are you, on a certain demographic, right? Males. Right. So you see, it's pretty cool. And here's another example where we were looking at breastfeeding initiation rates by income group in Winnipeg. And we found a really interesting trend upward, hallelujah. But at the same time, we found a shrinking rate difference gap between 1988 and 2004 when we did this study, which is really cool. Not only do you want the whole population to get better, you want shift, you want that Rose theorem to happen, everybody gets a little healthier, but you also want squish. You want the gap between the healthiest and the least healthy to get less. And that's exactly what we see in this data. The gap between the economic groups has shrunk. And interestingly enough, it is associated statistically significantly with the onset of the CPNP programs and other Manitoba-led programs in Manitoba, where that gap shrunk in breastfeeding initiation. And of course, Marnie's in the room, but she has the very famous slide. The first time we ever linked education data to our health insurance repository data, it was very cool because that's what the school saw. This is income assistance kids, low to high socioeconomic groups. That's what the school saw when they looked at their grade 12 language arts tests. 96% passed in the highest group, 76% in the income assistance. But when it was able to be linked to those who are getting universal health care insurance, a very different story appeared, because then you could find the kids that you think should have been in grade 12, or the kids that even weren't in any school anymore because they had dropped out along the way. And suddenly this gradient went from 11 to 81% pass rate. And that's the beauty of linking data sets so that you can see the true population effect. I was privileged to get a draft copy of this article, the top 10 areas of impact that you'll find in this magazine. Very impressive, and as I said, believe it or not, it is called The Top 10. So it's easy to find in your magazines, and it's probably waiting on newsstands as we speak in Ontario. So grab a copy. They've got great examples. Our top 10 downloads for the last fiscal year in our annual report is interesting because, you know, you'd think that would be the most recent reports that came out. It isn't. Surprisingly enough, some of our old reports are still downloaded, and this is the number of hits to download the report in this fiscal year alone. So, for example, our Métis Health Status report got 30,000 download hits last year, which is remarkable to me. I think a bestseller by definition in Canada on the book stands is like 5,000 or 10,000. So I'm sure your reports are getting lots of hits just like this. But look at this. There's one that Marnie did years ago, children, that is still getting 14,000 hits, and some of these in 1996 that are still getting hits. So it's amazing what people are still interested in and how much interest there is around the world. So where are we going for the future? What is the LBD of the future? You know, when I Googled this, I couldn't believe what came up. This is a dress that you just stick your SIM card in the back label, and it becomes your cell phone. Really cool. You just go like this, and it answers your phone. Wow, what you found. This is what we don't want to happen. We don't want, I haven't read this book, but it looks kind of depressing, so I think I'll avoid it. Two sisters whose lives seem forever intertwined are torn apart when a magical little black dress gives each one a glimpse of an unavoidable future. Ugh. Okay, so let's have a really nice future here. David, thank you very much, David, already explained to all of you beautifully the distributed data network analysis that is involved in our CNODES, or Canadian Network of Observational Drug Effect Studies, under the DCEN umbrella. That is so cool because we struggled for years to figure out, how do we put all of our data into one huge repository in the sky? Well, there's a lot of problems with that. Privacy, for one. Different data in different provinces act a little differently and are collected a little differently, so that's also a problem. But this is so cool. All we have to do is bring it up to an aggregate table, meta-analyze the results, and bang, we've got a Canadian answer to some of these long-standing questions. Why what is holding us back from doing this with education data or family services data or all sorts of other data? We could do distributed data analysis for social programs as well as something like pharmaceutical data. Then I noticed on your website that one of your key elements is health equity. And that is also our dream, to try to figure out research which will reduce the gaps, reduce the health gaps and the well-being gaps. And we've got one project that's going on right now that just started from CIHR called the PAS Equity for Children. And that is kind of cool because there's a lot of programs and policies that have happened in Manitoba over the last decade. Some of them step wedge designs in the school system or somewhere else. Some of them randomized controlled trials. And some of them just an event where we have to come up with a quasi-experimental design to evaluate it. But we are going back and we are evaluating much broader outcomes for much longer periods of time on the health and well-being of kids who were involved in all these different kinds of interventions. And not only can we do the different interventions, but we can do synergistic effects because they're all in the repository. So we can say, hey, if a child is exposed to this and this, is it way much better than just being exposed to that? Remote access sites. Just like your ISIS sites, we have CFI money, and we have 6 remote access sites. 1 is in a regional health authority. The other 4 are in university settings. And new linkages, cool. I have pleaded with those people who do a lot of RCTs. Why do you not put into your RCTs that sometimes only last 3 weeks or 3 months, why don't you do a longitudinal linkage to the data so that you can actually see 3 years or 10 years down the road from that RCT? So that's one of the things that we're working on here. So, Coco Chanel, a woman without an LBD has no future. Hey, we have a future. We have a future in Ontario, we have a future in Manitoba. With our electronic health records, we have an incredible LBD future. So, to end off, you know, Jay Leno and all those guys, they always have the top 10 kind of things. Well, I've got 9. Here's ISIS on this side, and then on the other side is the center. So, you guys are world leaders in clinical epi. We're probably considered world leaders in the social and health determinants using administrative data. You guys, of course, are the business center of Canada. I didn't say the center of the university, did I? No. Business center of Canada. And, believe it or not, right outside of Winnipeg is the longitudinal center of Canada. We're both very relevant to policymakers, planners, clinicians. You sometimes call it the army when it snows, which is right in your term, ICE, right? ISIS. And we call up the army when it floods, which is right in our MCHP, right? ISIS is big, and for those of you who watch the Vinyl Cafe, we're not big, but we're small, but does size really matter? We'll let you decide. Les Roos and MCHP has publication envy of ISIS, and sometimes ISIS has been known to have repository envy of MCHP. There's creative expansion through both of our sites. The CEO has a sexy accent, and hopefully I have sexy slides. And we both know how to work together. So this is definitely not our team model with MCHP and ISIS. If anything, there we are, and we're getting closer and closer with unique data linkages and distributed data analysis. With that, I'll finish, and David up here, you can get this artwork later. This is on behalf of all of us at the Manitoba Centre for Health Policy, and this is artwork by a Cree Ojibwe woman who was born in Winnipeg, Simone McLeod, who now lives in Saskatchewan, and this is called Looking Ahead. Oh, wow.
you.
All right.